My name is Lauren Morgan and I'm from Sarasota, Florida. My project aimed to explore how family adherence to CDC guidelines, change in community satisfaction, and perceived risk of COVID-19 severity was associated with adolescent depression and adherence to CDC guidelines. For my data collection, I was able to administer a survey to 68 students at Sarasota High School. Upon analyzing my data, I found that household adherence to CDC guidelines had a very strong correlation with individual adherence to CDC guidelines. This underscores that household behavior plays a protective role in adolescent behavior, and therefore, families should model proper precautionary health measures for their adolescents. I also found that increased community satisfaction was weakly correlated with decreased individual adherence to CDC guidelines. This negative association was minimal, but suggests that those who had increased community satisfaction within their communities were less prudent with precautionary measures because they may have been resistant to the constricted social environment. Furthermore, increased community satisfaction had a mild to moderate association with decreased depressive symptoms. Overall, community satisfaction acted as a risk factor for adherence to safety guidelines and a protective factor against depression. That being said, it is crucial that communities can reconvene while emphasizing health guidelines by consistently modeling safe behavior. As for my last factor that I studied, I found that COVID-19 risk perception was minimally correlated with increased individual adherence to CDC guidelines. Lastly, I found a moderate correlation between risk perception and depression. In general, risk perception played a protective role for adherence to CDC guidelines, but was a risk factor for depression. Therefore, it is essential that mental health resources are easily accessible to adolescents. All in all, the results of my study led me to conclude that consistent, science-based messaging is necessary to encourage safe behaviors among adolescents to ultimately reduce the spread of contagions. Thanks for listening.